We did cover choledochal cysts already, and remember that there are 5 different types of them. Caroli's disease is another name for the 5th type of choledochal cyst, and anything that has another name, boards love to ask questions about it, and it usually gets another name because it has some sort of significant factor to it. So let's take a look at what Caroli's disease looks like. As I mentioned, Caroli's disease is a form of choledochal cyst. It is the 5th type, and what we typically see are segmental dilation of the intrahepatic ducts. So it looks like little cysts, little bubbles all throughout the liver, and those are cysts of the intrahepatic ducts. Choledochal cysts are typically inherited, and with Caroli's disease, we see it more commonly in females. It is an autosomal recessive disease, meaning that a child can only get the disease if both parents carry the disease. And we typically see this in more of the young adult pediatric. We might not even recognize it until they get to be a little bit older and start to have some symptoms from it. Because this disease is also seen quite often with renal disease and with hepatic fibrosis, we're going to see more symptoms related to that before anything Caroli's disease really starts to be symptomatic. So typically other symptoms, other diseases associated with Caroli's disease are going to lead the practitioner to start to look for ultrasounds and lead the diagnosis to Caroli's. Clinically, these patients are going to have a lot of the liver, gallbladder symptoms that we've been talking about, pain, fever, and jaundice. The big thing with Caroli's disease is that they're going to have signs of portal hypertension. So if you remember back to what we learned about with portal hypertension, they're going to have reversal flow within their portal vein. They're going to have an enlarged spleen. They're going to have possibly some ascites, and that's because of that hepatic fibrosis. The liver can no longer accept all the blood coming in through the portal vein, and so it kind of wants to shunt it away, get it back out of the liver. And so again, that all comes back to the hepatic fibrosis that Caroli's disease causes. So let's take a look at what it looks like on ultrasound. I do want to start first with a CT picture. I think the CT picture nicely exhibits what Caroli's disease is. So remember, it's intrahepatic dilation of the bile duct. So we're going to see tiny little cysts scattered throughout the liver. And so they're going to look like little bulbs or bulbous areas that are dilated within the liver. You'll also notice that there's a little white dot in the center of all of these bulbs. This is called the central dot sign. The central dot sign is one of our key terms, and that little white dot that appears in the middle of our cyst is actually the hepatic artery. So when we see cysts throughout the liver with a central dot, central echogenic area, and if we put color on it, we get blood flow within that dot, that will help to solidify the diagnosis of Caroli's disease. This last picture again shows us cysts throughout the liver parenchyma and with that hallmark sign of the central dot. So remember that Caroli's disease is the 5th type of choledochal cyst. It is inherited, most likely affects young females. Hepatic fibrosis causes portal hypertension with Caroli's disease, and on ultrasound, it is cystic spaces with that central dot, and that central dot is the hepatic artery.